as you know, I've been a chiropractor and clinical nutritionist for 30 years. And I've practiced all around the country, and I've found that everybody pretty much has a lot of the same things going on. And so much of our health issues that plague us are very much lifestyle related. So it's about what we're eating, how we're taking care of our bodies, if we're moving our bodies, do we have a trainer, and also the mental condition of our health. In other words, what's our attitude like? So attitude is big. But what today I want to focus on in my practice is something that's unique and different from most offices, and it has to do with the muscle testing that we do. The muscle testing technique is something that I've been doing now for 30 years, from the beginning of my practice. And I find that it's a tool that's extremely beneficial for helping to get to the root cause of many health issues. It's quick, it's easy, and it's very accurate. And a lot of times I'll have patients come in that are a little bit skeptical, and I'll test them and I'll tell them what I've found, and then they'll go to their medical doctor and they'll get blood tests done. And the blood tests 99.9% of the time will confirm what I've already found on the muscle testing. Now, I do run blood panels on patients if necessary, if there's something that's just that we really want to nail down, if we need specific numbers like on lipid panels, cholesterol, that kind of thing, or thyroid function. But the muscle testing is a very accurate way of assessing the health of a patient. And so today I've asked Mr. Bloom if he would be my guinea pig, and I'm going to demonstrate the muscle testing for us. It really has to do with autonomic nervous system function. The autonomic nervous system is that part of the nervous system that controls everything that goes on in our bodies without us consciously being aware of it. And that's a lot of stuff when you think about it. It's our digestion, it's our heart beating, it's our breathing, respiration, it's our ability to go to sleep at night, to fall asleep, and the ability to wake up in the morning. So there's a bazillion different functions that go on, and so when we're testing the body, we're testing autonomic nervous system function. So one of the first things we do is to see if that part of the nervous system is not working. And there's a test that we do to find out if the person is what we call blocked. In other words, a patient's supposed to be able to down-regulate, to rest so that they can digest and heal. But if their nervous system is on edge all the time and on overdrive, their body can't down-regulate and they'll never heal. So the work that we do, you can take all the supplements in the world, but if your autonomic nervous system is blocked, then the products are not going to work. So the first test we do is to see, hold tight, he's been through this before with me, so when that goes weak, that's the only time a weak response is normal. That means his nervous system can down-regulate. So the work that we can do will help him. If a person is blocked, this will stay tight when I do that, which means that if we don't find out what stress on his body is causing his nervous system to be on overdrive, then the supplements that he would be taking would either not work or cause the opposite reaction that we're looking for. So we want to make sure that he down-regulates well, and he does. So then we go to the first point. This is the hormone point right here. And that's the master hormone reflex. The endocrine system, or the glands in the body that produce hormones, control everything that goes on in the body. So we look to this system first, the endocrine pillar, if you will, to find out how that's functioning. So there's a simple product which is a multiple glandular for the endocrine system. He holds that product in his body. We go here and he gets a little bit stronger. So there's a couple other things we can give him. That can help support the endocrine system. So he's, hold tight, lock, hold, good. He's getting stronger, and there's actually about 3 different products that we give for that endocrine pillar. One of them is black currant seed oil, which is an oil, see that's nice and strong now, that helps your body to actually produce hormones. So while he's holding that, then we go through and we do what's called the body scan. We're testing different areas of the body. Right here, the back of the head is called the cerebellar reflex. That's your balance center. It's also your memory and focus point. So a person has difficulty with memory and concentration or balance. We give a specific product that can strengthen that area back there. So short-term memory loss, we give ribonucleic acid, or balance, somebody who's off balance a lot, that can be helped dramatically with a specific supplement. Do you feel the difference there? That's nice and strong. So then we go to the pituitary, which is supported now, and then we can check the sinuses, which is weak, the eyes, the teeth. Teeth are big. I have found issues with patients who have tooth problems they didn't even know they had. I tested them, they go weak, I say, you've got an underlying immune challenge. They go to their dentist, they found out they have a little abscess growing they didn't know was there. That can have huge detrimental effects, especially on the heart. If that bacteria gets in the bloodstream, gets to the heart, they could have serious problems from that. So dental issues can really create huge impacts on the immune system. We can test the heart. Remember I talked about the broken heart syndrome. His heart's nice and strong. We test the lungs. We test the spleen, the stomach. A lot of people need hydrochloric acid for their stomach to break down the protein. Now that's nice and strong. That's Zypan. That's going to help make his pH in his stomach more acidic, so he'll digest his proteins and minerals. Then we can test gallbladder liver function. You know, no. We can make assumptions. We might be right. We might be right. I'm not saying anything. We're on camera here. Okay, so Liviplex is great for liver support. And then we can test the gut. Now this brings us to an issue of food allergies. This is the small intestine, and if that goes weak, then we have these vials full of different, the most common allergens that we consume. We put that right up there. That goes strong, so then we can test. I'm going to have you take all of these out of your hands, and we're going to do a very quick food allergy test. We have these vials that have things like corn, gluten, wheat, oats, sugar, and we can just run through these and see which ones of these are weak. Now he's super weak, that's wheat. Now a lot of people are sensitive to wheat because they don't have the enzymes necessary to break them down. So we put the enzyme in his hand, put wheat back up there, and he's nice and strong. So his pancreas is weak and tired. It's not breaking down sugar properly. So a lot of people think they're gluten sensitive, but they just don't. They're not digesting their food. A lot of people think they're lactose intolerant because they react to dairy. But a lot of times it's not that they're lactose intolerant. It's that their gallbladder is not working. We get the gallbladder functioning, and then they suddenly can start eating the fat. So then we can test other things like regular white sugar, which is poison for most people. You don't want to be eating the sugar. And then corn is a big one. Corn, unless it's organic, it's GMO'd, it's a neurotoxin. So a lot of people are really super sensitive to corn. Don't eat corn tortillas. And here's dairy. You're okay with that. And then here's gluten. And hold. So gluten makes him weak. But when we put the multizyme back in there, give him gluten again, he's stronger. So again, we have to get to the underlying root cause of what's really happening with the patient in order to really give them the best advice. And then there's, that's goat milk. Everybody tests strong for goat milk. Very few sensitivities. And here's oats. So the carbohydrates are definitely an issue. You need some pancreatic support, and enzymes will really help calm this gut down and actually get you to break down your carbohydrates. And one of the biggest issues with cholesterol is not consuming fat, and I've talked about this before. It's about the carbohydrates, which causes inflammation, which brings the cholesterol levels up. So if we can deal with how the patient handles carbohydrates, number one, reduce them in the intake, but also get the body functioning so it can break them down properly, that'll affect the heart, the weight, prevent diabetes, and reduce cholesterol and prevent heart attacks. Wow. Thank you very much. I appreciate it.